Hello and welcome to another episode of the Health Notebook. Today we have Mr. Eber Collop in the studio, and he's a physiotherapist, and we'll be exploring the topic of back pain, and he will be giving us some advice in terms of management of back pain. Eber Collop, welcome to the studio.
Good day, Dr. Essop.
Mr. Collop, can you maybe just tell us a little bit about yourself? We understand that you're a physio, but just explain to us a little bit about your background.
I was born in Atlantis, but grew up in Matroosfontein, Elsies River.
Okay.
Yeah, so I'm a local guy.
Local Cape Townian. Okay.
Local Cape Townian. I attended school in Elsies River, primary school, J.S. Kloppers, and then I went to Pinelands North Primary and I matriculated at Pinelands High School. After that, I studied at UWC, where I completed my physiotherapy degree.
Okay,
Yeah.
and then I know you've been involved in quite a bit of activities as a physiotherapist, so just run us through your experiences after qualifying as a physiotherapist.
The main reason why I started physiotherapy was because I had a love for people. I had a passion for people, wanting to help them, wanting to make a difference in people's lives. And I also didn't want an office job.
Okay.
That's why.
So you're more a hands-on person.
I'm a hands-on person, love talking to people, love helping people. And I decided I wanted to do physio so that I can assist people. I saw it at an open day when I was invited to the old Conradi Rehabilitation Hospital, and we saw what the physios were doing there, helping people to walk again, helping people who lost their limbs, the stroke patients. And I also had a love for sport. And watching soccer, you always see the physiotherapists running on the field, and I always aspired to be one of those.
Okay, so were you involved in sports then afterwards? Or?
Yes.
Okay.
I started being involved with sports as a student, still volunteering my time for the UWC cricket team, and later on I got a bursary through the Sports Skills for Life Skills cricket team, just as a bursary for my studies, and that's how I got involved with the cricket first, and that created an opportunity for me to go to Varsity Week. And there I was elected to be the physio for the South African student team.
Okay,
Yeah.
That's quite an achievement.
Yes.
Okay.
And that was just the beginning of everything, because once that was on the CV and I volunteered at the Cape August cycle tour, the Two Oceans running marathon, built up a little bit of a CV, and as soon as the position became available at Santos Football Club, my CV spoke for itself, and I was appointed head physiotherapist at Santos Football Club.
Okay, so that's quite an achievement that you've come so far from where you've come, and I think it will also inspire other individuals to actually go the same path that you actually went down. Now, in terms of your sports physio, I just want to tap into that a little bit. Can you maybe just tell the viewers what are the importance of actually exercising before playing sports, or some tips in terms of the aspects of sports physio, and some examples.
Yes, so for the elite athlete, it's important for him to be in the fit condition, okay, that his body does not break down during the season. So it's part of the physio together with the biokinetist that works together as a team to prepare the team physically for the sport that they're about to play. Part of the physio's role is also prevention of injury and to treat them once they are injured. So once someone has an injury, we run onto the field, we do a quick assessment to see can they continue, can't they continue. We give the coach that advice, and once the game is done, that is when the physio's role really starts. Just treating all the knocks they get, the injuries they might be, managing it correctly, because if you manage it correctly in the beginning, the time period for healing is minimized, and we'll get that player back on the field as soon as possible.
Okay, now when you say treatment, can you just highlight to the viewers what type of treatment do you offer after the injury, after some sports injury? So just one or two examples.
So immediately after, we have to just do a full assessment to make sure what the injury is. Once we know what the injury is, it's in the first 24 hours, you always start with what we call just prevention of further injury, rest, ice, compression, and elevation. So we make sure that they do that. We sometimes do protective strapping, okay, and we sometimes have to put them in the moon boot just to keep their foot so that they don't put too much pressure on the foot. And for other people who just have muscle injuries, we just might have to make sure that they don't injure it further. So we prepare them for the next day when they see us in our rooms, and we use dry needling, and we also use our hands. Physio is a hands-on thing, so we do soft tissue mobilization, and we do massage, we do lots of stretching. I like to emphasize the importance of exercise in the rehabilitation process, in getting the muscle back and stronger and flexible as soon as possible.
Okay, now that is from a professional point of view. So if you could just give the viewers 1 or 2 tips, what should they do before they exercise to prevent injury?
It's good you asked that question, because there's lots of people that are doing the park runs now, and they're into the road running, all the family events, and I'm seeing quite a few, especially the ladies, with injuries like your stress fractures or muscular injuries, but that is because of lack of preparation for the event. You cannot just go on the day and do the 5K.
Okay, so what would you advise in terms of preparation?
So in terms of preparation, I will advise that they have a screening assessment done, where we can see are there any tight muscles in certain areas, how strong the muscles are, and then we can decide from there what demand they can cope with.
Okay,
you see?
so you probably give them like a program to say, okay, we're working on this muscles, you need to strengthen these
so
particular areas.
once we have the assessment, we analyze the results, and then we will then give you a specific program to address the certain deficiencies, and it's what we call periodization. So you can't just go and run a 5Ks to prepare for a 5K.
Like
we need to start slowly and build up to that.
Okay, it's like some people would just get up and say, okay, tomorrow I'm doing a 10-kilometer run, and they haven't been exercising over the past year.
Yes, you have to prepare your body, both physically and mentally and spiritually, for what you're about to do. So we sometimes just prepare ourselves mentally, we get the mind right, we are going to do it, but the body is still not in a fit
end up with a
condition.
number of injuries after that.
Yes, then you end up with a number of injuries after that.
Which is difficult to treat then as well.
Yes, as we say, prevention is better than cure. So it will be better to prevent the injury so that you can enjoy the activity that you are doing. So the main thing is that they just need to build a little bit of exercise to strengthen your leg muscles, your quadriceps, your hamstrings, and your calf muscles. So it's important to do that initial baseline exercise before they just go into a race.
We'll be moving a little bit to the topic that we are going to be discussing today, and that is back pain. I do understand that it's one of the most common injuries, and it's also one of the common problems and symptoms that adults present with. So from the physio perspective, I know from the medical side there's many causes, but from the physio side, just highlight some of the causes or risk factors as well in terms of back pain that actually lead to back pain.
One of the main causes that we see, it's people that have incorrect posture. It can be in sitting, walking, incorrect ergonomics, meaning they're not picking something up correctly when they're lifting from the floor. We see it in school kids where the bags are a bit too heavy, or they're sitting with slouch posture, playing PlayStation all day in. So what happens is the muscles in front become tight, and then the muscles at the back become very weak, and they don't have enough endurance, and when they need to do something, they get hurt. And then you get the people that sit in office, sitting for too long. They say sitting is the new smoking, because sitting has many medical hazards, and one of it is that it just causes stiffness in the lower back because of incorrect sitting. When you slouch, your vertebrae are in a certain position. Your vertebrae are supposed to be in a good normal alignment so that the center of gravity can go through all the vertebrae equally. But as soon as you slouch, there are certain segments in the spine that absorbs all that pressure and the weight of your body, and that is when you're then prone to injury in that area.
Okay, so those are the shock absorbers between the vertebrae that you were speaking about.
Yes.
So the disc, the intervertebral disc.
Yes. So forms of lower back pain, you do get people, to use the layperson's term, slip disc, but it's nothing slips or anything out. It's just a disc that bulges or herniates, and then that can cause a rupture of the gel-like pad, the shock absorbers, and that can cause pain in the lower back. You can also get the disc bulging out and pressing on a nerve root, and when that happens, that is when you commonly get the people who say they feel the pain moving down their leg.
So you've mentioned ergonomics, and you've mentioned a little bit in terms of posture. So those are sort of one can actually institute preventative measures for that, right?
Yes.
Now, just to put the viewers into perspective, you'd get the pure medical conditions, and then as you mentioned, then there's the ergonomic conditions, posture, exercise as well. So all of these are risk factors besides the medical conditions which you also manage. Now, in terms of preventative measures for ergonomics and posture, what would you advise the public?
First thing is we need to correct the posture, and you correct your posture by doing certain exercise and making sure that the muscles that hold you in that posture, has enough endurance and strength to do it during the day.
If you could just point out, can you maybe just show the viewers what you're speaking about in terms of the different types of muscles that go into tension here?
So I'm going to use the neck as an example. So in your neck you have muscles that are supposed to hold your neck upright, okay? There's muscles at the back and you get muscles deep in front. So if you're in a wrong posture sitting on a laptop, your head moves forward like that, you hinging on a specific area at the back, and you're looking up and typing on the screen or looking down or on your cell phone. So what happens is these muscles at the back, they become short and they become very weak, okay? So then they cannot hold you in a correct posture. And when you bend forward like that, you hinge there, the whole forces of your head, of your head is only going through 2 vertebral segments and not through all 7 in your neck. So you're more prone to injury at that C5, C6
Okay,
area.
and that's one of the common causes. And
Yes,
most
so-
people are now sitting in front of the desk and busy with the computers.
Yes, yes. So the ideal, and that we call a forward leaning posture, the ideal thing is that the chin must be tucked in and your ears must be in line with your shoulders. That's when you know you're in a correct posture.
Okay.
So as soon as your ears are a little bit in front of your shoulders and your shoulders are rounded, you must know you're in the incorrect posture.
Okay. Now, just going back to back pain, we know it's fairly common now. Just in terms of the literature, what's your take on back pain?
The 2010 Global Burden of Disease study rates lower back pain as one of the top 10 most prevalent injuries in the world.
Okay. Can you then also now differentiate to the viewers in terms of acute and chronic back pain? Just differentiate that as well.
Okay. So acute is normally when there's what we can call a fresh injury, when someone has just hurt their back, the first episode of lower back pain, and that is normally they need to, I'll say, see their physiotherapist, for that, just to make sure that, so we can identify early on the level of injury, the degree of injury, so we make sure it doesn't become a chronic problem.
Okay.
Too often people ignore the lower back pain thinking it will come right. 3 months later the pain is still there and it just becomes worse.
Okay. And then just to put into perspective as well, that's also the importance of seeing a medical practitioner to rule out other causes, and then the medical practitioner can then also refer to you as well.
Yes, so they can see the GP, and the GP will then from there determine and then refer to the physiotherapist. If you are 100% you hurt it while picking up something and there's no medical thing, physios are first line practitioners as well, so you can go, but your physio will also assess and he can also see if you need to see a specialist or the GP as well. There is a start back screening tool as well. It's a questionnaire that they will do. You will answer the questions, you'll get a score, and from that they will rate you in 3 different categories. Category 1, normally you just see the GP, they can give you meds and it will resolve within 2 weeks. Category 2 is when there are physical impairments, and that's when physiotherapy gets involved, and with treatment that should resolve in 3 to 6 weeks. And then you get the level 3 where it's the chronic phase, where it's something that there are psychological barriers towards progressing and towards healing as well.
Okay. So now just going back in terms of common presentations of back pain and associated signs and symptoms.
Yes.
So just to inform the viewers, can you maybe just highlight 1 or 2 medical conditions where there is a little bit more than the common back pain?
Yes, so you normally get, as you said, your mechanical lower back pain, which is just due to posture and muscle strain and small ligaments in the back. That is very localized pain, so you will feel the pain in the back and spreading across the back, sometimes occasion in the buttocks. And then you get something that we just call lower back pain with radiculopathy, which is referred pain down the leg. Often people will come in and say they have a pain in their foot or their knee or their leg, and with no injury to the leg, and then that is actually when the nerve root has been entrapped or a little bit damaged in the lower back pain, in the lower back, causing pain referring down the leg.
Okay, so now you have a person with back pain. Just run us through some of the processes that you've taken the history, as you've mentioned, you've used your tool as well. So what would you do as a physio? I know it's individualized per person. So what would you do as a physio just some ideas.
Once we do the assessment, we'll then see whether it is lack of movement in the spine, whether it's a muscle that's been hurt. Once we identify the cause, we can address that, and we'll address that by using our hands-on techniques, which is our lower back mobilization techniques. We will actually go on the spine to create movement in the different segments in the spine. We will also do exercise to strengthen the muscles around the back, the muscles that causes stability. Most people refer them to as the core muscles. So that is important, just to keep your spine as strong and stable as possible. In certain instances, people need more flexibility, so we'll give you stretching exercises so that the muscles can be allowed to move, so that it doesn't keep your back in fixed positions.
Now, in terms of additional modalities, like ultrasound, I mean, what other additional modalities are there?
Yes, in the acute phase where there's still inflammation present, we do use ultrasound. Okay, it's not the imaging one, it is a different type of ultrasound, but we just use it to help decrease inflammation, improve circulation in the muscle and the tissue around there. And what we also do is we use electrical stimulation, and also TENS, which is a transcutaneous electrical nerve stimulation. All that does is it plays around with the pain signals, okay, so that we can reduce the pain, the intensity of the pain in the area.
Okay, and what about hot and cold therapy as well? Just the value that will add in your management.
Yes, it's believed that ice helps in the acute phase to decrease the inflammation, and then later on, if you have a chronic muscle spasm, heat on the muscle also helps the muscle just to relax. And then we'll normally heat the muscle up a little bit, and then we'll do a bit of a massage, and then we'll go into a stretching technique. That's more for your chronic type patients.
Okay, and so how long would a average management of back pain with a physiotherapist last? How many weeks in duration?
Yes, if it's an acute, non-complicated case, most likely by the second or third session there is big improvement, and you will feel the relief. If it's more of a chronic nature, and that you can go onto a program that might lead up to 3 to 6 weeks. Okay, and then in your severe cases, it can be like a maintenance phase where you have to attend the physio class, the lower back care, and just take care of it throughout the year. So people then feel better, but then within 3 months it plays up a little bit, and then we just have to maintain it.
So from a medical perspective, I know each case is individualized as well. Now, just going also in terms of post-surgery back pain as well, I'm sure it's something that you see. So just to touch on that, the importance of physio after a operation, after you've had your back injury sorted out, and after you've had your disc sorted out. Some advice on that.
Yes, post-operative physiotherapy is very important. The physio will explain to you what you can do and what you can't do. The physio will help you get out of bed, because people are normally afraid to move, but you need to move from day one post-operatively, walking as much as you can, but we must be careful of how we bend and when we need to start bending and what to do. But the physio will then guide you through that. We will also give you exercise just to improve the strength and endurance of the muscles that's stabilizing the lower back.
Now, I know after surgery, or even just for a person with normal back pain, there's this whole debate about braces and if they're good and whether they're not good. So if you could just inform the viewers of what is the value that a back brace can add, and I mean, in terms of your opinion, can you just explain the different types of braces?
Yeah, there's different schools of thoughts around the braces. If you had a fracture of your back, you need to wear a brace, because you need to prevent you from bending over on that specific level of where the fracture occurred. But if it's a normal operation for a discectomy and things like that, the surgery is quite stable afterwards with the new technology that is out there, and the surgeons good hands. Yeah, there is no need for a brace immediately, because the physio will teach you how to use your muscles to use for a brace for your back. So it depends on what type of surgery you had for your lower back.
So just to touch in a little bit of about what you said in terms of using your muscles, just explain that to the viewers. What do you mean by using your muscles as a brace?
Yes, so you have your deep muscles called your transverse abdominis. It's right in the bottom of the lowest level of your abdominal muscles. You also have small muscles that go from vertebrae to vertebrae, which is called your multifidus. And then you have lots of supporting structures around your back, all the muscles. So if we get that strong and we get you to know when to contract it, how to hold your posture, it forms a brace, so it actually protects the back from any sudden move, you know. If something should happen, that you don't just flop or overcompensate, that the back can at least protect that specific area, especially after surgery. When you just got up, we need to show you how to get up properly and how to walk, and when walking, so that when you put your foot down, that it doesn't jerk too much on the one side. So we teach you how to use your muscles to act as its brace itself. If people get used to the brace and they just wear the brace all day, it makes the muscles weaker, and therefore it's very difficult to then let go of the brace. Then you see people are wearing brace for months or years, so we need to teach your muscles from the beginning how to do the job.
So it's sort of a gradual phase in of the muscles, obviously depending on the individual and the age of the individual as well, and things like that.
Yes.
Okay, now in terms of conservative management versus surgical intervention, just wanted to take some in.
Yes.
I know we would normally first try conservative management from a medical practitioner's point of view, so just your thoughts about that.
Yes, it's conservative management has proven to be very effective when it comes to lower back pain. If there is a disc bulge as well, there are treatment modalities that we use, and we can actually facilitate the movement of the disc back into place. We can also do specific movements to decrease nerve entrapment at the individual space in the lower back. So when it comes to conservative treatment, it's very effective, and surgery should be the last port of call. There are cases where the damage is too bad,
and that's based on your medical condition.
Yes,
Yeah.
And that's why it's important also to work quite close as a multidisciplinary team. You need to be in communication with the doctor,
with the specialist,
yes, so that we can all work together as a team and consult and say what is the best way forward for this patient.
Now, so we've almost reached the end of the show. So, if you could just explain to the viewers, you've come a long way. You have your own practice now. So, if you could just give the viewers or those people intending to do physio some type of inspiration or motivation as well.
Yes, Dr. Essop. If I look at myself, I grew up in Matroosfontein, a township in Elsies River, and I am living proof that you can get out of your circumstances if you're willing to just be dedicated and determined towards your studies. I must say thank you to my parents who were very supportive for me. But if you put your mind to it, you can achieve a lot. And just by hard work, I ended up working with the soccer team, and I currently also have my own physiotherapy practice.
And you've actually grown the practice over a number of years, if I'm not mistaken.
Yes.
Okay. And what type of patients do you see in the practice?
Okay, we're fortunate enough to have an outpatient practice where we see walk-ins and people that are referred by the GPs and the doctors, and we also have an inpatient physiotherapy practice where we treat babies, we treat people in ICU and in the general wards as well.
Okay. Mr. Collop, it's been a great pleasure having you in the studio, and we hope to see you at your practice where you can give the viewers some practical advice in terms of stretching, in terms of lifting up boxes. So thank you very much for coming.
Thank you, Dr. Essop. It's a pleasure.
So there you have it. We've had Mr. Collop in the studio that gave us some brilliant advice in terms of preventative measures for back pain, some ideas in terms of some ideas to prevent sports injuries. So stay tuned for another episode, same time, same place next week.